Vancouver's mayor is demanding action from higher levels of government after another violent attack in his city.
There's a lot of anger, actually. But the anger comes in the sense that we already knew that incidents like this would happen again if senior levels of government didn't step up.
The NDP government announced in September plans to expand involuntary care for people with mental health and addiction issues. That plan includes using highly secure facilities, including at the Surrey Pretrial Centre and the Alouette Correctional Centre in Maple Ridge, where people apprehended under the Mental Health Act can be detained. Sims supports that idea, but says it isn't rolling out fast enough.
You know, they announced that they're going to add more beds for mandatory compassionate care. We need them now. We can't wait 6, 12 months for them.
Premier David Eby says he understands the frustration.
It's a horrible attack, and it's really corrosive to people's sense of safety in communities. And we don't know all the details of this one, but I think it's fairly safe to guess that mental health, addiction, brain injury were components here. And so there's real urgency around rolling out that work.
Eby insists the government is expanding that involuntary care program as quickly as possible.
We should have beds open in Maple Ridge and at Surrey Pretrial in the spring, which is critical. And then as we get that model down, we'll be able to deploy across the province to provide the support that people need.
Vancouver's mayor has also asked Ottawa to step up, calling for further bail reform and federal funding to shore up the involuntary care program.
It's been silent. It has been crickets. It's been 79 days since we made that request and nothing from the federal government. And that's where I get really angry.
Last year, the federal government did pass reforms that were supposed to make it harder for violent and repeat offenders to be released on bail. Critics, however, say bail reform has to be paired with preventative measures like wraparound mental health and addictions treatment. Katie DeRosa, CBC News, Victoria.